In today's video, we're going to look at the large intestine channel and its 20 acupuncture points. So let's get going. Hi, I'm Clara from Acupro Academy, and I create acupuncture and Chinese medicine content for practitioners and students, making it easy to grasp and fun to learn. If you found this of value, please give me a like or even subscribe so you don't miss out on any future video. And now, let's rock it. Welcome back to my channel. In today's video, we're going to look at the large intestine meridian pathway, and we're going to look at each of its 20 points. Location, how to locate them properly, easily as well, and function, making it easy to grasp and fun to learn. As you know, this is my motto. So without further ado, let's start it up. So we are going to start by looking at the large intestine channel pathway. Before we do this, we have to remember that the large intestine is a Yang channel, right? And it is a Yang Ming channel. So Ming being brightest. It's the brightest Yang because it comes from the Ming dynasty. So it's the Yang Ming channel, which the other one, which is a foot Yang Ming channel, is the stomach. This is a hand Yang Ming channel because it starts at the hand. Anything that starts or finishes at the hand is a hand meridian. Everything that starts and finishes at the foot is a foot meridian. So this is a hand Yang Ming meridian. It is most active between 5 and 7 a.m. in the morning. 5 and 7 a.m. This is probably the best time to evacuate, to have a bowel movement, to let go of the stools and everything that needs to be evacuated in the morning. So that's the best time to have a bowel movement, when we wake up before we have breakfast and start the beginning of digestion, which is the opposite end at the stomach. The large intestine meridian pathway starts at the index finger because that's where the long channel finished. So we start at the index finger and we're going to go along the back of the hand, or the dorsum part of the hand, all the way in the posterior part of the forearm to the elbow, along the upper arm to the shoulder. Okay, so that's 1 to 15. We're going to have 1 here, 2, 3, 4, 5, 6, 7, 8, 9, 10 on the forearm, 11 at the elbow, and then all along the arm we'll have 12 to 15. Then we're going to go in the back. So we're going to go to the back to large intestine 16, which is where the scapular spine and the clavicle meet at the acromion. And this is going to be large intestine 16, which is the only point of the large intestine that's in the back of the body. It's going to go to C7. So it's going back to C7 where DU14 is. DU14 is really powerful because all 6 Yang channel will meet at DU14 or meet at C7. So it's really an important area. Then it's going to come back to the front and it's going to enter the body through the supraclavicular fossa, so right behind the clavicle. Now it becomes internal. That was all external. Now it becomes internal, and it's going to connect to the lung organ and the large intestine organ, its own pertaining organ, right? That's the main meridian. The first branch and only branch of the large intestine is going to start at the supraclavicular fossa, and it's going to ascend along the neck to connect with 2 of the points on the SCM, or sternocleidomastoid, which is large intestine 17 and 18. And then it's going to enter the jaw, the lower jaw, and cross the lips to end up in the opposite side of the ala nasi, which is where large intestine 20 is. 19 is above the lip. So this is the only meridian that crosses the body. It comes from one side, finishes on the other side. Both sides will cross. That's the only meridian that crosses the body, so that makes it a very powerful meridian. And that's the pathway of the large intestine meridian. Done! Let's look at the location of Li1 to Li5. Li1 is located at the base of the corner of the nail, just 0.1 soon from the radial side of the base of the nail. Li2 is located distal to the second metacarpal phalangeal joint, while Li3 is proximal to the second metacarpal bone head. Li4 is halfway between the second metacarpal bone, between the first and second metacarpal bone, closer to the second one. Say that again 3 times. And Li5 is on the anatomical snuff box when you hyperextend your thumb. Now that we've looked at the locations of large intestine 1 to 5, let's start looking at the function of those 5 points. Li1 is a Jingwa point. So as a Jingwa point, it's used mostly, as all Jingwa points are used, for fainting, coma, high fever, manic behavior. Not a lot to say about Li1. Large intestine 2 and 3 are pretty much have the same function. They are going to be used mostly for toothache of the lower jaw, as we saw in the pathway of the meridian, since it goes right through the lower jaw. So if there's toothaches, to help decrease the inflammation, those 2 points clear heat specifically for toothache or nosebleeds due to excess heat. They are both a special shu transporting point, the yin spring and the shu stream, so that makes them obviously a little bit more special in that perspective. Now, if you want to know more how the shu transporting point, the 5 shu transporting point work, click the link above here and watch the video that I create on it, because it's quite useful to help in that matter. Let's keep going. Okay, the big kahuna, the big point of the large intestine, Li4. That's probably one of the most used points in the clinical practice, with stomach 36 and liver 3 probably. So Li4, the first thing we have to say, it is contraindicated during pregnancy. So let's get rid of the no. Do not use it during pregnancy unless it is at the end of pregnancy and you're trying to help the patient with labor pain, and also with induction when that is deemed necessary. So having said that, Li4 is a fantastic point. First of all, foremost, it is the commander point of the face. So anything happening on the face, you can use Li4. And it could be anything from acne, for jaw pain, for nose or nasal, stuffy nose or nasal issue like nosebleed. It could be anything around the eyes. So things like dizziness, itchy eyes, twitch of the eyelid, anything happening on the face. So if you have any TMJ or trigeminal neuralgia, anything on the face, Li4 has to be your guiding point. It has to be part of your protocol. Also, because it is also on the face, any headaches, it is going to be very useful, specifically frontal headaches or orbital headaches. The second thing that Li4 is best for, it is a best point for any kind of pain anywhere in the body. Any kind of pain anywhere in the body, meaning it is the best point to move blood. And this is why it's counterindicated during pregnancy, because it is the best point to move blood, which makes it the best point for any pain anywhere in the body, acute or chronic, because it moves blood to relieve pain. So that is such a powerful, useful point. Before I continue, because there's so much to say about Li4, let's look at the tip of the day. So as you can see, when people drink too much, Li4 is a great point for the post-drinking headache. Combined with gallbladder 8, gallbladder 8 is great for hangover because it reduces the foggy head. And of course, dizziness, stomach 40 is a great point for dizziness, and calming also the stomach, because it is the lower connecting point of the stomach to the spleen. So this is a great combination that we looked at. Hope you enjoyed the tip of the day. Now let's continue with Li4's function. Li4 is obviously connected to the lungs, so it is a great point to expel pathogen when there is pathogen invasion, like when heat, when cold, and any kind of bacteria and viruses. You want to use Li4 specifically in conjunction with lung 7 and stomach 36 to boost the immune system and the Wei Qi, the defensive Qi, as well as obviously expelling the pathogen. The next point that I want to really talk about is Li4 is the yuan source point of the large intestine. Yuan source means it's the source, like yuan qi, the source qi. So this is a really good point for any kind of deep-seated large intestine issues. Someone that's had chronic constipations for years, or chronic IBS, so any large intestine colon issue, you have to put Li4, because it is going to be the best point specifically for chronic long-time issues. And that was all about Li4. Li5 is a great point to clear heat, specifically for external pathogen invasion. So when there is invasion of wind heat, for sore throat or ear pain or ear infection or toothache, specifically the lower jaw, or headache due to external pathogen invasion, that is the point we want to put. So you can put Li5 with Li4, of course, because Li4 expels the pathogen. Li5 clears the heat. It's also used sometimes for manic depressive people, specifically in the manic stage when there is that excess heat, that hyperness of the manic stage of someone that has either bipolar or manic depression. Now let's look at the points located between Li5 and Li11. Li11 is located at the lateral end of the crease of the elbow. All points are going to be located between 5 and 11. Li6 is 3 tsum directly above 5 on the line between Li5 and Li11. 7 is located 5 tsum above 5, still on the line between 5 and 11. 8 is located 4 tsum below 11 on the line between 11 and 5. 9 is located 3 tsum below 11. And 10 is located 2 tsum below 11, still on that line. So having your elbow bent helps a lot. Make sure to remember that when you locate those points on the forearm. And that's that. Now that we've looked at the location of Li6 all the way till Li11, let's look at the function of those points. Li6 is the lower connecting point from the large intestine to the lung. That means that it is a really good point when there is allergic reactions or an acute allergic reaction which creates swelling, specifically swelling of the face or swelling of the throat or the upper body. This is really a good point because it is going to reduce the swelling. Now, if someone has an allergic reaction and swelling is the symptoms that come up with it, Li6 connects the large intestine to the lung. The lung is in charge of the weight chi, the defensive chi, right? So I would put Li6, but also spleen 9, best point to clear dampness, right? And Li4, because Li4 will also expel the external pathogen which created the allergic reaction in the first place. Stomach 36 and lung 7 to boost the chi. That's a great combination. Li7 is easy. It is the chi cleft point of the large intestine. All chi cleft points of the yang channels always help with pain. So this one is really good to add when there is large intestine pain or lower abdominal pain in the colon. Any issue, it doesn't matter. This is going to reduce the pain. Of course, we always want to do a TCM diagnosis, figure out why the pain is there, but this is going to be a great point to use in conjunction with Li4 again, because that's the best point for any pain anywhere in the body. Li7 will be great for large intestine pain. I've grouped the next 3 points together because they basically have the same function, which is really local pain. So for anybody that has extensor or carpal tunnel syndrome that really creates a lot of pain on the extensors, those are great points. So 8, 9, and 10 are fabulous for local pain. Easy, straight to the point, done. Are you enjoying my graphics so far? Well, you can find them all in my AcuPoint Made Easy, an illustrated guide to all acupuncture points, and so much more. The PDF version has a lot of video links. You can download it on your phone, your tablet, your computer, and have it at your fingertips at any time. It has a great table of contents. The hard copy ships all over the world if you're someone that loves to hold a book and really enjoy the colorful part of my graphics. You'll find them all exactly the same as the PDF in the hard copy book. The feedback has been amazing. As you can see here, so many people have just loved the book or the PDF or both. So what are you waiting for? Click the link below and get your copy today. Let's get back to what we're talking about today. When I teach my first year student at the college, the first time they needle, I give them Li11 as their first point to needle because it's easy to locate, as you can see, and it's also an easy point to needle. I love Li11 because it is a Rossi point. It is at the elbow, so all Rossi points are either at the elbow or at the knee. This is the last of the 5 shoe transporting point. And so the Hussey point of the large intestine clears heat. Not only that, but it is the best point to clear heat in the body. Doesn't matter if it's external or internal, acute or chronic. It could be an infection, it could be inflammation, it could be high fever, sore throat, hives, bowel issues, smelly stools, diarrhea. It doesn't matter. Any heat in the body, you want to use Li11 to relieve the heat. On top of it, this point is a ghost point. I love ghost point. And if you haven't watched my video, it was a live YouTube video on the ghost points. It is right up there and you can click the link and watch as you want to learn more about the ghost points. So we had a fun time doing that video. So I encourage you to check it out. So Li11 is a ghost point, and as a ghost point, it is here to calm the mind, specifically for people that feel out of control and get very angry and agitated when they're out of control, and that results in bowel issue, like people that have IBS or diarrhea due to feeling really upset, feeling really angry, and they're feeling out of control, and it creates bowel issue. Best point for that. Let's look at the location of Li12 all the way to 15, all on the arm. Li11 we know is at the end, lateral end of the cubital crease. Li12 on the other hand is one zoom above Li11, closer to the edge of the humerus. Li15 is going to be located high on the shoulder, interior and inferior to the acromion. So the acromion is right here and it's just interior and inferior to it. And the 2 points, 14 and 13, are going to be located between Li15 and Li11. Li14 is right where the insertion of the deltoid is, and it is 7 soon above 11, on the line between 11 and 15. While 13 is located 3 soon directly 11, on the line still of 15 and 11. Now that we've looked at the locations of those points, they're pretty simple in their function. Li12 all the way to 15 are all going to be local pain and local issues. So they treat any issues affecting the shoulder, the arm, the elbow, and specifically pain that travels down the arm that is affecting all those areas. One tip I would give you is if someone has frozen shoulders, or any kind of rotator cuff injury or shoulder injury, one of the best protocol that I use in clinical practice is I do cupping. I do use very mild electroacupuncture, and the points I use are Li15, Li14, Sanjiao 14, which is the opposite side of Li15, Jian-Chen, yes, that's an extra point that is located between the anterior axillary fold and Li15. So halfway between the anterior axillary fold and large intestine 15 is Jian-Chen. That's a great extra point to add. On top of it, I will usually obviously add Li4 because it's for any kind of pain anywhere in the body. So that is a great combo. Again, Li4, Li14, Li15, Sanjiao 14, and Jian-Chen. Those are a great combo for shoulder pain. The large intestine 16 is located between the lateral end of the scapular spine and the lateral end of the acromial head. So it is more in the back. That's the only point that's actually located in the back. Nothing much to say about Li16 except that it's a great local point. So that's what we use it for. You just have to be careful when you needle it and stay shallow. That's all I would have to say. Li17 and 18 are located on the side of the neck by the SCM, or the sternocleidomastoid muscle. So Li18 is at the laryngeal prominence, or the Adam's apple, between the two heads of the SCM, while Li17 is one zoom below Li18 on the posterior border of the SCM. And that's that. Li17 and Li18's location is not quite as easy. Also, patients might feel a little bit more intimidated, or practitioners have a hard time to figure out if they feel confident in needling anything along the SCM, the sternocleidomastoid, but they are very useful. And if you stay shallow in your needling, no problem, okay? They're very good point for cough, asthma, sore throat, anything happening with thyroid issue as well. They can also help lower blood pressure. I would say that stomach 9 is a better point for that, which is in the anterior SCM at the same level of Li18. But there are other points that do all this, so if you don't feel like those points are you're not confident in nailing those points, or the area feels unsafe to you, it is completely safe. Yes, the jugular is there, but there are other points. So that's my little tip on that. Last but not least, Li 19 and 20. Li 19 is located at the level of Du26, which is right above the lip and below the nostrils, directly below the entrance of the nostril, while Li 20 is at the corner of the ala nasi, by the side of the nostril. Pretty simple and easy. All made easy. Done! Last but not least, Li 19 and 20 have the same functions. So in clinical practice, we use Li 20 much more often. I think it's just because it's easier and it's less sensitive than above the lip, but also the function of Li 20 is very strong. Its name in Chinese means beautiful fragrance because it opens the nose, right? So they work really, really well, but Li 20 works so well. I usually needle it upward towards the bridge, the top of the nose. So it kind of looks like you have little horns coming out, right? And so those points are fantastic. Those two Li 20 on both sides to open the nose. If someone has acute or chronic stuffy nose, of course, you still want to do a diagnosis in TCM, right? And figure out the root cause so you can get to the root problem. And obviously, so this person does not have chronic issue for, ever. But in the meantime, it really is good for allergies, to open the nose, for nosebleed, for people that lost the sense of smell. Now, if you are watching this video, it depends what time it is, but we are in 2021 in the midst still of COVID-19, and the lost sense of smell and taste is one of the symptoms of COVID-19. So that is a really great point to try to stimulate the nasal passage after when the person is recovering, right? Specifically combined with lung 7, because it's a great point to go to the head, and Li4 to go to the face. So those 3 points would be a good combination. I hope you really enjoyed that. Now let's put it all together easily from the first one to the last one. Ready? Li1, Jingwell point, fainting, high fever, normal Jingwell point. 2 and 3 are for nosebleeds and toothache of the lower jaw. Li4, as we know, has many functions: headaches, any pain anywhere in the body. It's also for large intestine issues, clear external pathogens, and it is counterindicated during pregnancy because it is the best point to move blood. Li5 clears heat for external pathogen invasion. Li6 is the luau connecting point to the lungs, so great for allergic reaction that makes the person swell. Li7 is a Shiklev point, best point to add when there is large intestine or lower abdominal pain due to colon issues. Large intestine 8, 9, 10, all local for pain in the area. 11, best point to clear heat anywhere in the body. And it is also a ghost point for people that feel out of control and that create some bowel issues. 12, 13, 14, 15, 16, all local MSK, musculoskeletal point. 17 and 18 on the neck for lowering blood pressure or any sore throat, thyroid issue, asthma, breathing issue. And then 19 and 20 to open the nose. I hope you really enjoyed this and you really benefited from it, and keep watching because there's more to come. I hope you enjoyed the content today and found a lot of value into it. Please subscribe so you do not miss out on any future videos, and watch those two here to have more content for you to enjoy and absorb. Have a fantastic day, and no matter what, keep rocking it using TCM.